So, number one, there are three specific suggestions that I have. I think the budget allocation to the program should dramatically increase. Its basic principle of finance is what matters is opportunity cost. So, recommendation two is a income transfer program for those who are suffering from critical illnesses.
Freebie.
Freebie, okay. Let's. That's a loaded word. Third is for those state governments which have not implemented the program. See, what is happening is in some states, it is the election campaign managers who have become economic advisors. Hello all, welcome to episode 6 of Finterpret. This is Prasanna Tantri. I teach finance at ISB. With me is Aditya Muralidharan from Center for Analytical Finance. We are discussing a paper of mine titled How Does Health Insurance Program Covering 500 Million Poor Impact Credit Market Outcomes. This is accepted at the Management Science, top journal in management. So we have done 2 episodes. This is the last episode of this paper. We are not ending the podcast. We will do, Aditya will be free from after this. So we are going to continue with others. So let me quickly summarize what we did so far. Of course, you can visit the 2 episodes and see for yourself. You will get all the information in detail. But those of you starting from here, let me quickly summarize. In episode 1, Aditya, we discussed about the main finding of the paper.
Yes.
We said that because of Ayushman Bharat, loan default rate of beneficiaries has fallen by a third.
Yes.
So before Ayushman Bharat, they were defaulting around 12%. These are poor people, and it fell to 8% after Ayushman Bharat. So we compared those states where it was implemented and those it was not implemented, and did a border district test, and we have explained it in episode 1. And we also discussed some sort of macro implication. A rupee put in Ayushman Bharat, we said it benefits up to 3 rupees to the economy, and it can be as high as 5 rupees also. This was episode 1.
Yes.
In episode 2, you were not convinced with the macro side. You said, what's the benefit per family? And you only told us, with the comparison of private insurance company policies, that Ayushman Bharat is like free health insurance policy, right? So, to replicate Ayushman Bharat for a family of 5-6 people, you said it will cost at least 35,000.
Yes.
Right, and you said if you have elderly people, then private insurance you have to buy 2 policies.
Yes.
This is worth 2 policies, worth 35,000. This was the main point.
Yeah.
And we were also discussing, some issues. You raised some issues, and we discussed and all that. This is where we are.
Yes.
So finally, in a nutshell, Ayushman Bharat brings down default rates by 1/3.
Yes.
It benefits the economy by at least 3 rupees for a rupee put in the program.
Yes.
And most importantly, the benefits are worth 35,000 rupees per family. Right? This is the whole summary of what we did.
Yes.
Right?
Professor, now that we have discussed the paper in so much detail and have found so many interesting things coming out of it,
yes.
Are there any specific things that you think can be brought or changes that can be brought into the particular scheme, in your opinion?
The Ayushman Bharat scheme.
Ayushman Bharat.
Right. So, number one, there are 3 specific suggestions that I have, based on this paper.
Right.
Not everything is an outcome of the paper. It's about thinking about this program. Number one, I think the budget allocation to the program should dramatically increase. Now, you know the numbers. You were telling me the numbers. Before we get into why should it increase, can you tell to our viewers what is the amount of allocation that is made to this program, and how does it compare with other important programs that government runs?
Right. So, as of 2023, the money that was put into the scheme by the central government was close to 6,100 crores.
Okay.
And plus there was additional infrastructure expenditure that the government made on Ayushman Bharat, which was again close to another 2,000 crores.
Right.
Now that there is a share between the center and the state,
60-40.
60-40.
So maybe that's around 4,000 crores.
Correct. Right. So then the total amount that the government has spent on this for financial year 2020
from the budget
in 2022-23 is close to 13,000 crores. 14,000 crores.
And now, how does it compare with other schemes, let's say?
So now if we take NREGA for that matter, it's close to 90,000 crores.
Right.
And if we take
that was in that year, COVID, but last year also it was 80,000.
80,000 crores.
Yeah.
Correct.
Yeah.
And if we see PM Kisan,
which is 6,000 rupees.
Kisan Samman Nidhi, that's another 6,000 rupee cash transfer that we were talking about. That's another 50,000 crores.
It's thanks to West Bengal does not implement that also. We discussed it. Otherwise, it would have been more. So initial budget allocation was something like 70,000 crores.
Yes. So
this is like one fifth of those schemes.
This is like 1/5 of those schemes.
Yes.
And also, if let's say if we take in proportion of our GDP, it's like those schemes are 2%, 1.5, 2%, and this is like close to 0.2%.
Yeah, of the budget.
Of the budget.
Not of
yes,
the GDP.
Yes.
So
yes.
GDP is 300 lakh
Yes,
crores, so
yes.
which is fair enough.
Yes.
Right. So that's what I say. That's one of the reasons I say that this should increase.
Right.
The amount invested on Ayushman Bharat seems too less compared to all other schemes. So, you're smiling.
So, but like on just a lighter note, but not like on a critical note.
Okay.
When I was hearing your podcast with some of the other people before we roped you in,
Okay.
the one of the claims that you made is that this whole the whole idea that the public goes mad about that, why is the government not spending enough? And you were specifically talking about education, that why is government not spending enough on education? Those kind of things are not the matter of concern. The matter of concern lies that the teacher accountability is not there, the teacher training is not there. Those are the things that need to be focused. You particularly deviated from the topic that the allocation need to be made. Whereas when you talk about this particular scheme, it's completely different. Your number one recommendation was the budget allocation should increase.
Sure. So you sort of caught me here, and this is why people have to be careful while speaking. But let me tell you on your critical question on a serious note.
Right.
Look, we are empiricists. We go by data.
Right.
So research says, and when it comes to education, there is established research, and I think you didn't watch the podcast fully. I cited research also, which says the issue is not about money there. The issue is about teacher accountability.
Yes.
But let me not go there. But then when it comes to health, I can tell you money is an issue. It is, it doesn't mean that just because in education money is not the number one issue, doesn't mean in health it is not. Let me first make a conceptual argument. Then let's get into data.
Okay.
So what the government has done in Ayushman Bharat is they put a rate card. For every treatment, and you know it well. For this much, bed so per night so much.
Right.
For you were saying so burn this much, for that disease this much, and so on and so forth.
Right.
Now what it does, this is a pure official bureaucratic way of thinking that something costs this much, add some margin, so this is what you should charge.
Yes.
A fundamental principle of finance, basic principle of finance is what matters is opportunity cost. Right? If I have to keep you in ISB, I have to pay you what the next best will pay you. Else you will not. So can I pay you like for your food this much is required, for your lodging so much is required. So then you keep 20% more, and then you should be happy. That's not the way it works. It's opportunity cost. So when you put a price cap, what happens is somebody has to sacrifice that. So now the question is, who will sacrifice and why will they sacrifice? You will not get the best doctor. The best doctor will not treat. Because you can't afford to pay. In fact, I've seen statements by many of the hospitals, which you were also discussing, that they find it not profitable at all. Right? And best facilities cannot be given. I'm not saying it has to be 5-star high-class facilities, but the rates seem to be so low. A lot of private hospitals complain that even reasonable facilities cannot be given for such people. So if you increase the rates, you will be able to afford that quality kind of treatment, and you already see the multiplier effect. So it is not that you lose anything. So the whole idea, the policy makers here should get out of this cost plus kind of a way of looking at it and think of opportunity cost. And that is why we said, so private insurance cost, we said 35,000. Here the spending per family, we said 2,000. So some of this cost saving is artificial because government has put a cap on what they're going to pay. So this cap, I understand you can't pay completely 5-star facilities. Now, I'm not even asking for that. But the fact that private hospitals are saying, at least government should look into it, that what is the cost, so it is not, their approach should change. It is not that how much it costs to keep that bed. What should they ask is, by diverting that bed from something else to Ayushman Bharat, what is that hospital is losing? That's the question they have to ask. Right? As long as you don't compensate the hospital for their opportunity cost, they will not do this wholeheartedly. Because look, I can use that. So this assumes that the hospital bed is unemployed, the doctor is unemployed. Doctor is not unemployed. Same time, he or she could use it for something else. Right? So that's the issue with principle. So moment you put a price cap,
Right.
then you will only get the resources which are equivalent to that price.
Right.
The best resources won't come.
Right.
And allocation, and it's not that government cannot afford.
Yes.
So the reason I asked you to say the proportion of budget, it's doubling or tripling from here is very easy.
Yeah.
It's not going to disturb any of and those some of your viewers may worry about fiscal deficit and all. It's nothing. Our fiscal deficit is like 17 lakh crores. Right? Even if you increase another 10,000 crore, it's not going to change anything.
Yes.
And I already told you multiplier of this.
Yes.
Right? So that is the conceptual argument. Why you should not have that kind of caps.
Right.
It should be opportunity cost. That's number one. Right? So you seem to be not happy with this also.
No, sir. Like, I completely understand the idea of rate card and why, and I think the reason of government doing that is also to be careful about the moral hazard issue, right? Tomorrow any like hospitals can charge any amount and can get the claim from the hospitals from the government, right? So that part is not very, very clear when we think about giving that kind of a flexibility to the private hospitals. Will it not?
See, that is a different failure of the of market failure, where there is lack of competition.
Right.
That's why you should have enough hospitals.
Right.
There should be enough competition.
Right.
Did telecom prices go up or go down after a lot of people come in? So the thing is competition.
Right.
Right. If you allow more entry, and there is no time to get into.
Yes,
then it's we'll get into a different debate altogether.
Yes.
But definitely the current rate seem too low. The principle, I don't know. All that I'm asking you for is a re-examination, right? The principle that we are compensating you for cost is a wrong principle. That much I can tell you. Look at opportunity cost, and once you even after base of opportunity cost, if you think this is what you need to pay, then I will agree. But my sense is I have not done the costing. Let me admit directly. But I have another evidence, based on which I think costs do matter, right? You have studied. We keep talking about 4 non-implemented states.
Yes.
You have looked at their schemes.
Yes.
Can you explain to the viewers what are the kind of schemes like state like Odisha has, which did not implement Ayushman Bharat?
Yeah.
West Bengal has.
Yes.
So can you explain that? Then I'll continue my point why cost matter.
Sure. So when we are comparing the implemented and non-implemented, West Bengal and Odisha is what we primarily look into, which have their own policies, insurance policies, health insurance policies. West Bengal has its Swasthya Sathi program, and Odisha has Biju Kalyan Yojana.
Sure.
And in principle, all the 3 schemes, actually the state schemes are a little better in terms of their facilities, but they all have.
Telangana also has.
Telangana also has, yes.
Right.
And they in principle they are the same, but the only difference is the bigger difference is coming from the coverage point of view. These states are covering a larger population of.
Stop. See,
yes.
These state schemes are covering a larger population on paper, right?
Yes.
Now, what is the number of patients treated in these states versus states where Ayushman Bharat is available?
Yeah. So it is, Ayushman Bharat is close to 4 times the percentage of treatment.
Okay, so you are telling me a comparable state, which has on paper a better scheme than Ayushman Bharat, which covers more population, versus another state which has Ayushman Bharat. So the state which has Ayushman Bharat, number of patients covered, treated, not covered, treated by the program is 4 times higher. Now tell me, I can only think of 2 reasons. One, in those states, people are extremely healthy or they don't get any disease at all. Or they are getting excluded in implementation. Right? So, which is the more plausible reason, even if you don't have any data? It's the latter, right? Because these governments have rejected 60% free funding from the central government. Ayushman Bharat is nothing but 60% of your health expenditure will be taken care by the center. That's the way you should look at Ayushman Bharat. So now their budgets are stretched. Although they've designed schemes which are better on paper, number of people treated is not higher. If a particular state government scheme covers 83% of the population versus 50% in Ayushman Bharat, the number of people, in fact, as you go higher, the treatment should have been more. Why is it less? Right? That tells you resources are a constraint. Finance is a constraint. So that's another reason why allocation should go up. So I think, more, at least my first recommendation is, at least they should study whether they have to increase spending on the basis of opportunity cost. Let me tell you another reason. And you have this data, I know, because you worked with me on this paper. We have 600 odd districts.
Yes.
Do we have 600 odd district hospitals full-fledged?
No.
We don't have, right?
Yes.
So district can be 100 kilometers, 150 kilometers in some places. In Arunachal Pradesh, it can be much more.
Yes.
Arunachal Pradesh is close to Madhya Pradesh, as big, although population is smaller.
Yeah.
Now, when you don't have these facilities, where will these people go? Right? This is, when I say spending, I don't mean you have to spend more on the insurance itself.
Right.
We have to work on a war footing to increase these facilities. Right. Either increase public, you said 2,000 crore is getting implemented, which is a good thing.
Yes.
But that number of hospitals with facilities, either public hospitals. If you're going to empanel private hospitals, then you have to make it profitable for them.
Yeah.
You can't make them do the government's job.
Yes.
Giving you for less than market price is government's job.
Yes.
You can't tell them. So if you want a private hospital to set up shop, hospital in those districts, you have to make it. And fact that they have to go all over there. A specialist doctor will have to go and live in a village. The amount of compensation that you have to pay them is going to be higher, not lower.
Yes.
Right now they are paid lower.
Yes.
Right. So markets will work in its own. It has its own laws.
Yeah.
It won't bend to wishes of policymakers.
Right.
So either set up public facilities or you make it profitable to private players.
Right.
If you put ceilings, any kind of price ceiling, price ceiling will lead to inefficiencies.
Prof, now that we have addressed the first issue that you raised, that budget allocation needs to be increased in Ayushman Bharat.
Yes.
What is your second recommendation?
So recommendation 2 is a income transfer program for those who are suffering from critical illnesses.
Are you suggesting a cash transfer?
Absolutely.
A freebie?
Freebie, okay. Let's. That's a loaded word. Yes, I'm a sort of. I don't know what you mean by freebie in this case, but what I mean is those who are suffering and hospitalized, they should be given some income support. So let me give you the rationale why that is important. See, this 1.5 crore number that you said, those who got treated, that is not the number of people who fell ill. There's a large section which is afraid of even getting tested.
Right.
It's not like you and me. When a taxi driver or some small self-employed person falls ill, there is nobody giving them income. There is no paid leave.
Right.
There's absolutely, in most cases, no insurance also.
Yes.
So it's not only, so what the scheme is doing a great thing of taking care of their expenditure.
Yes.
But then there is another loss of income that is happening.
Right.
Who will take care of the family? In many cases, we don't know. Children may have to go out of school.
Yes.
May start working. So this is another major. Given that there is space in the budget, government tax collections have been good. Right. So my recommendation is, I'm not saying if you have a fever, give some income transfer. Some cancer patient or these there are
critical
doctors
illness.
who can define. I'm no one to define what's a critical illness. Right. But those who get admitted or those who have to get treatment which requires admission for a long period of time should be provided with an income transfer, which is at least can take care of the family in the meanwhile. Right. So what this will do is this will encourage people to get tested and hospitalized. Yes. Otherwise, the really poor people may not even be getting they may not be getting tested at all.
And the delayed address.
They delay, and that delay makes it worse.
Yes.
Imagine a cancer patient or a heart patient who has some symptoms, but is worried that if I stop working, what will happen to my family or my regular income? Who will take care of school fees and whatever? So those kind of things can be addressed. So the second, so it will not be your 1.5 crore. Again, it won't blow up the budget. We can give the number. Right. See, the average spending hospitalization is 15,000 rupees.
Yes.
It's only few lakh cases where these critical cases.
Yes.
Right. And the kind of income minimum wage kind of 300 rupees. We are anyway spending 80,000 crore on Narendra. Yes. This won't be, this cannot cross more than 5,000 crore. 5 to 10,000 crore. And I know you will bring up moral hazard. But no one will inflict themselves with cancer for your 3 months allowance at you, and it has to be defined up, until from the time of admission till recovery or some sort of income support. That's my second recommendation.
Right. Finally, Prof, what is your third?
Third is for those state governments which have not implemented the program. Okay. So see, what is happening is in some states, it is the election campaign managers who have become economic advisors. It is totally I don't know who told them not to. It's a freebie which the center is giving.
Right.
60% of your healthcare expenditure. You take it because the benefits of the program, as we said, are multiple. It will accrue to state economy.
Yes.
And the citizens who actually see the benefits when the economy, I said a multiplier of 3 times or 5 times, they will not be able to say that it's all because of central government or anything.
Yes.
Even this political party at this, in my view, political benefits to even opposition parties is higher than the cost. So their argument is entire benefit will go to the center.
Yes.
This is based on this narrow view that only those who are treated are benefiting.
Yes.
We established in our first episode that everybody is benefiting.
Yes.
Economy is benefiting.
Yeah.
And when the economy benefits, then everybody benefits.
Yes.
And when then it is, people feel good, and the chance, now we know that people vote differently in central and state elections. In many states they have done it.
Yes.
Right? So I don't think even politically this is a bad idea to accept a central government scheme.
Yeah.
When your budgets are constrained.
Yes.
States are going to courts today asking for more borrowing limit and all that. Here is a scheme where center is giving money and you are not taking it.
Yeah.
So I think it's totally ill-advised measure that states have adopted. So my third recommendation to those states which have not adopted this scheme, they should immediately take it.
Okay.
And they won't lose out, even politically. That's because the benefits are more than direct. There are indirect benefits which will accrue to the entire economy. These are my 3 benefits. So with this, we'll wrap up our discussion on this paper. So we'll come back with another paper on banking crisis on India. We'll start, and I'll let Aditya go. I'll find another PhD student or RA for this. Thank you so much, Aditya.
Thank you, sir.